I'm about to perform the head to toe assessment. I have explained to my patient the procedure. I have also explained to him the right to refuse any steps of this process at any time when he feels he doesn't want to do it. First, I'm going to be doing the face, skin, and head. I'm going to start off by the head. I'm going to palpate the scalp to make sure there aren't any abnormalities, which there aren't any. I'm going to inspect the scalp for any lesions, dandruff, or any alopecia, which there are none. His hair is appropriate for a race. It's shiny, looks healthy. Next, I'm going to inspect the skin, which has no lesions, no scarring, no nevi, no any of that. Everything looks appropriate. Next, I'm going to look at his eyes, checking for any drainage, any redness. There aren't any. Look at the conjunctiva. It is pink. I'm going to next check his pupils. I'm going to check his pupils. They are round and reactive to light. Next, I'm going to check his temporal arteries to make sure they are present symmetrically. They are present. I'm going to ask my patient to open his mouth for me. Now I'm checking his temporomandibular joints. Do you have any pain when you open your mouth? There is no pain noted. Next, I'm going to ask my patient, the sniff test, can you hold one nostril closed and sniff for me? Okay. Can you do the other one? Okay, both nostrils are patent. Next, I'm going to assess his cranial nerve 5 and 7. I'm going to ask my patient to smile for me. Can you frown? Can you puff your cheeks? Can you close your eyes tight? Can you clench your jaws for me? Clench your jaws to check for strength, which strength is appropriate, has good strength. Looking at his eyebrows, his eyelashes, they are growing appropriately, symmetrically to both sides. They are not growing back outward. They're growing the correct way. Check the cranial nerve 5. Can you close your eyes for me and let me know if you feel anything? Cranial nerve 5 is present. With the maxillary and frontal sinuses, I'm checking for any pain. There is. Do you have any pain when I palpate these areas? There is no pain noted. Be assessing the eye. I'm going to be assessing cranial nerve 2 by using the Snellen chart at 20 feet. I'm going to ask my patient to read the lowest line that he can read, the smallest line that he can read.
PEZOLCFTD.
Okay, thank you. Next, I'm going to be assessing cranial nerves 3, 4, and 6. I'm gonna ask my patient to hold this index card over one eye. Okay, can you do the other eye? Okay, thank you. There are no extraocular movements noted. Next, I'm gonna be testing the pupils for size. Make sure they're equal and reactive to light, which they are. Yeah, they're both equal and reactive to light. I'm gonna hold my pen light up. Can you look over my shoulder for me and look at that wall? And look back at my pen light for me. Okay, can you look back over my shoulder again and look back at the pen light again? Okay. Both pupils are reacting symmetrically. Next, I'm going to ask the patient to follow my hand movements, just with your eyes only. Eye movement is appropriate. There is no extraocular movement. He is following my finger appropriately. I'm inspecting the ear. I'm going to be palpating it now to checking for symmetry. There are no masses. There are no lesions. No sores. Next, I'm going to do the whisper test. I'm going to stand 2 feet away. I'm going to ask my patient to close his eyes for me. I'm going to whisper something. He does hear me. Next, I'm going to do the Weaver test. I'm using the tuner fork. I'm going to hit it and put it on top of his head. It's going to be checking for hearing conductivity. Should hear it in both ears symmetrically. He does hear it. That's checking cranial 8. Next, I'm going to be checking the Ryan test, which I'm going to be sticking this on his mastoid process, which is checking for bone conductivity. He's going to let me know when he doesn't hear it anymore. Next, I'm going to be checking for the air conductivity, which should be twice as long. He's going to let me know when he doesn't hear that. Alright. It was twice as long, which is normal. Next, I'm going to be checking the mouth and throat. I'm going to check his tonsils to make sure they're not swollen. Okay, this pink. When it says ah, I'm going to check his uvula to make sure it is vibrating, which it is. I'm going to ask him to stick his tongue out, which is cranial nerve 12. Can you stick your tongue out for me? It is symmetrical. I mean, midline. Sorry. It's midline. Okay, you can stick it back in. Teeth are present. I'm going to check his gag reflex, which is cranial nerve 9 and 10. Okay, reflexes are present. Looking at his uvula. Buccal mucosa is pink. There are no ulcers, no masses. Everything looks good. Assessing the neck. The lymph nodes I'm going to be assessed. First I'm going to assess the periocular lymph node, which is in front of the ear. And then I'm going to assess the post-auricular lymph node, which is behind the ear. And then I'm going to assess the occipital, which is below the periocular. And then I'm going to assess the submental, which is right under the chin. And then I'm going to assess the submandibular, which is right at the back of the chin. Next, I'm going to check the supraclavicular, which is right under the clavicle bone. Check those lymph nodes. And then I'm going to check the posterior cervical, which is on the side of the neck. I'm checking those and make sure there is no tenderness, or make sure there is no pain. They should be movable, they should be small. Next I'm going to check my patient's range of motion. I'm going to ask him to put the chin to your chest for me. Can you turn your head from side to side? Can you touch your ear to your shoulder for me? Alright. Next I'm going to be assessing the cranial nerve 11. Asking the patient to give me some resistance to my hand. Alright. Alright. I want to ask the patient to hunch your shoulders up for me. Okay. They are symmetrical. They're even on both sides. Next I'm going to palpate the trachea. It is midline. There's no pain. There's no swelling. I'm going to check behind and to check the thyroid. You turn to the side for me. I'm going to ask them, can you swallow like you're drinking some water? Oh, and it is moving up. That is a normal movement for the thyroid when the patient swallows. Next I'm going to palpate the carotid arteries. I'm going to do it one at a time. Okay. They are present. Pulse is present in the carotid. Next I'm going to check for the bruit with the Bevelmont stethoscope. Listening for bruit. I'm going to be assessing the posterior chest and back. I'm going to inspect, palpate the back for lumps, bruises, or asymmetry. Ask my patient to breathe in, take a deep breath. It is symmetric. Both my hands are moving at the same time, so it is symmetric. I'm going to auscultate. Next, I'm going to auscultate for breath sounds. You just breathe normal for me. touch sounds are clear. On the palpate uh, for vibrations. You say 99 for me?
99.
Say 99 for me?
99.
99?
99.
Alright, I'm feeling vibrations. Next, I'm gonna percuss, comparing the sides. They're all dull. There are no airfield, high-pitched places. Tell me if you feel any pain. There's no pain on the causal flank pain on the kidney areas. We assessing the upper extremity. I'm going to be expecting and palpating the arm. I'm expecting the arm. I'm looking for any discoloration, any bruises, any rashes. Hair is present on each arm. Everything is good. Next, I'm going to be palpating the pulses. Get the radial. Palpate the ulnar. I'm also going to be palpating the brachial in both arms. Alright. Next, I'm going to be checking the capillary refill. All the pulses are present, +2. I'm checking for capillary refill, which is checking for circulation in his arms, and they are good. Alright. Next, I'm going to be, they are blanching in less than 2 seconds. Next, I'm going to be checking for range of motion in the shoulders. You can just raise your arms up to your side for me. Alright, can you let them down? Can you let them up? Up will be abducting and down will be adducting. From your elbow, can you raise it like this? Flexing, you're gonna out extending. And then you turn your hand like this. Okay, that's the pronation. Push against my hand for me. Pull up. Go on both sides. Alright, he has good strength in both of his arms. I was just checking for resistance. It all was good. I'm going to be checking the range of motion in the wrist, hand, and fingers. With your wrist, can you flex it? Okay. Can you extend it? Hyperextend it and flex it. Make a fist for me. Can you spread your fingers? Okay, that's good. Next, I'm going to be checking the cerebral function. Can you close your eyes for me? Touch your nose. Hold your hand out to the side. There you go. Go back to your nose. And then can you do it with your opposite hand as well? I think that's cerebral function. Next, I'm going to be checking for the graphesthesia. Ask my patient to close his hand, hold his hand out. I'm going to put something in his hand to see. Can you tell me what that is?
A ball.
Alright. Next, I'm going to draw a number in your hand. Tell me what number it is.
1.
Alright, that's the stereogynous. Next, I'm going to be checking the reflexes. This is checking for the bicep reflex. I'm going to hit my feather muscle. Next, I'm going to check the tricep. Next, I'm going to check the brachial. Alright. I'm going to be assessing the anterior chest. I'm going to be inspecting for any lumps, lesions, rashes, any bruises. Make sure the rise and the fall of the chest is symmetrical. I'm going to inspect and palpate for the PMI. I'll do some medicine. auscultate the aortic, pulmonic, the tricuspid, and the mitral. I'm gonna do that also with the bell of my stethoscope. Aortic, pulmonic, tricuspid, and the mitral. S1 and S2 is heard. There are no murmurs. Next, I'm gonna inspect this stomach. The umbilicus is midline. It's warm. No hernias. I'm gonna also take my bowel sign, check for bowel sign. I'm also gonna check for my renal artery. Bowel sounds I heard. Next, I'm gonna percuss my quads. Then I'm gonna palpate, light palpate. Next, I'm gonna deep palpate my quadrant. Next, I'm gonna palpate for my liver. There shouldn't be no tenderness, no pain. I'm looking for grimacing my patient. I don't see any. Everything is fine. I'm gonna be assessing my lower extremities. I'm gonna inspect my legs. The hair is even. The size of it is good. There's no lesions. There are no bumps. There are no rashes. No swelling down the shins. Checking my pulses. I'm gonna check my popliteal pulse, which is present. Check my posterior tibial pulse, which is also present. And I'm going to also check my dorsalis pedis pulse, which is present bilaterally. There is no tibia edema noted. Check my range of motion. I'm going to raise his leg to his chest. It's good. The other leg. I'm going to adduct it, abduct it, adduct it. Both legs. Okay. I'm going to check the range of motion in his ankle, his feet. Plantar, can you press against my dorsiflex it? Can you do it inward, outward? Now can you just dorsiflex? All right, back. There you go. Next, I'm gonna be checking the cerebral function. I want you to run your heel down your shin for me. There you go. And same with that leg. I'm gonna check my Achilles reflexes. I'm gonna have my patient sit up. No, I'm gonna check my Babinski's first. I'm sorry. Just rub my hand against his heel. There's no flaring out noted. I can sit up against. Check my my hammer. I'm gonna check my knee reflexes. All right. Next, I'm gonna ask my patient, can you stand for me? Can you walk on your heels for me? All right. Now on your toes. All right. Next, I want you, can you put your feet together? Close your eyes. Stand with your hands out. That's gonna be my Romberg test. Okay, thank you. Just checking your balance. I'm gonna assess your spine. Can you stand up straight for me? Bend over. I'm just assessing. I'm looking at his hips, making sure everything is symmetrical and even, in which it is. All right. ask, can you hop on one leg for me? I'm just checking the strength of your leg. What about the other one? Alright, can you touch your toes for me? Alright, can you twist at your waist from side to side? Can you lean from side to side? Can you bend backwards for me? Thank you. That's it.